name is Lorena. I'm a transgender woman. I have a question about that. Well, I've been homeless for over 2 years, and my question is, basically, I've been looking for help for over this period. When I get to the agencies, they ask me, are you drugs? No, I'm on drugs. Are you HIV positive? No, I'm not HIV positive. Do you have alcohol problems? No, I don't. So basically all the help that you get around the city is just for people who have any kind of these problems. My question is why agencies are waiting for people getting those kind of problems to help people who we are not. And every day is the same thing. Do I have to get something that difficult to someone listen to me? Well, that's my question. Is whether can answer that question.
Wow. So that's a big issue within the transgender community, especially in the world, because so many people come in and we have the individuals in the community who are HIV positive, so they qualify for our housing programs. We have individuals who are mental health issues or substance abuse issues, so it's very easy to get them placed in housing and treatment and work with them around transition. The challenge has been for transgender women who don't have a substance abuse issue, don't have a mental health issue, don't have HIV. So there's been a challenge. That is a challenge. I think what we can do as a community is try to empower and employ and educate around those issues, because I think if I don't have HIV, if I don't have a mental health issue, I don't have a substance abuse issue, what can I do to empower myself as an individual to try to get access to housing? Unfortunately, even I had to tell an individual today she was a female, she didn't have HIV, but she was behind her rent. The resources are limited, unfortunately. So I think we as a community can get together and see what we can do for those individuals who don't meet the special population criteria. How do we assist those and empower them as access to housing, access to education, healthcare, who don't have those substance abuse, HIV issues and stuff. So I think that is a good question, and also it just raises alarm that we as a community, we need to begin to figure out how we can address the situation around housing for people who don't meet the special population criteria, who would easily qualify.
Well, first of all, I want to say thank you for being outspoken on this issue, because this is an issue that we have been screaming about for many years. And I know that, there's not a lot being done. And my first recommendation is, sometimes for trans people, when we have problems, so many problems, we have to be part of the solution. And my invitation is, I know that you're doing great things, and I think this is probably something that you could help the different organizations. Certainly, I want to make an invitation for you to become more active with the DC Trans Coalition, because right now there's just a few conversations happening throughout the city. I believe next week there's going to be a hearing at the City Council on homelessness for LGBT. It's about youth, but you could raise the issue that it's not only as youth. But what I do think is you should never give up. Knock on doors, one will open. I know the one that you knocked with me is halfway open. And I'm so glad it's still there and you're not giving up. So, but be part of the solution too. Because sometimes there are so many issues, some of them we don't have the answer for. But you could be part of the answer, and I think you're on your way to doing that. She's training with us to be an HIV counselor. She just completed her first training yesterday. So I think, you know, that's one of the tools how you can get out of that situation, but also empower yourself to do and deal with the one you're living with right now.
And I'm going to sound like a broken record because this, again, brings up something that I think so many of us, whether we're trans or not, are struggling with in this country, is that we are more than willing to pay the dollar for the pound of cure. But we are completely unwilling, in so many instances, to pay the penny that it would have cost to keep us from getting sick, or needing care, or being homeless in the first place. So, and I think that goes along with so much of the conversations that we hear about these so-called social determinants of health, right? Which actually really just mean where we live, where we work, where we go to school, the streets that we walk down every day. And at this point, what this country has been telling us is that we don't matter until we get sick. That they care about our health, but they don't care about our housing. They don't care about our jobs. They don't care about the streets that we walk down every day. All they care about is what is it going to cost them when we end up in the hospital, or when we end up needing HIV/AIDS care, when we end up needing substance abuse treatment. And I've been doing a lot of thinking about the HIV/AIDS epidemic in the 1980s and the way that we really, in that case, were told in so many ways over and over and over that we didn't matter. And that our health didn't matter, that the circumstances in our lives didn't matter. And we turned that around and said, actually, we do. And actually, we need to talk about making sure that our community is not getting sick, that our community is not dying. We need to talk about what it takes to keep us healthy in the first place. And figuring out how to have those conversations and how to get the ears that control the resources that pull the strings is a really tough thing. And I can only echo what my fellow panelists have said already so eloquently about how every time each of us stands up and tells the story of how we are not slipping through the cracks. We're so slippery through all the time. No, we are being shoved down through the cracks. And how each and every one of us stands up and says, excuse me, you can't do that to me. I'm part of this community. I need services. I have things that I can give back, and I have things that I need. That brings us that much closer. And I wish I had a specific answer, but as long as so many of us, as long as you're in this position, I think the best thing that I, as the talking head, can do is to say that we need to continue telling those stories, telling our stories.